My name is Jenna Byrd, and today I'm going to be talking about the drug class anticholinergics. So the different drugs for anticholinergics, the prototype is atropine. There's benzotropine mesylate, which is cogentin, dicyclamine, ipratropium, which is Atrovent, oxybutynin, scopolamine, tiotropium, which is Spiriva. So this mechanism of action actually block the action of acetylcholine in the brain. They inhibit the action of the parasympathetic nerve impulses. By acting on the muscular or musculosklerotic receptors, these nerve impulses actually help control functions such as saliva, digestion, urination, mucus production, and they can help control involuntary muscle movement. So some of the pharmacokinetics is the absorption. They absorbed in the proximal part of the small intestine. They can also be absorbed topically, intravenously, or intramuscularly. They're distributed systemically throughout the body. They're metabolized in the liver, and they're excreted in the urine. So some precautions that you want to warn your patient about is the chance of having a heat stroke or having heat exhaustion. So the anticholinergics, they decrease how much you sweat, which causes your body temperature to rise. So when you're outside or you're in the sun, you're in the sauna or whatnot, you actually your body doesn't sweat as much, so it doesn't cool down, so you have a more apt chance of increasing your chance of stroke or heat stroke. So contraindications for this, they're not usually prescribed for elderly patients. It's actually proven that over the age of 65, they are worse in confusion, memory loss, and mental function overall. And then recent studies have actually found where it increases the risk of dementia. There's some other conditions in which anticholinergics should not be used, and that's myasthenia gravis, hyperthyroidism, glaucoma, enlarged prostate, hypertension, Alzheimer's disease, tachycardia, heart failure, liver disease, and Down syndrome. So some adverse drug reactions you're going to find with this drug class is dry mouth, blurry vision, constipation, drowsiness, sedation, hallucinations, memory problems, trouble urinating, confusion, delirium, decreased urinary output, all that good stuff. So drug interactions, you want to look for things that can make this toxic. So a lot of the antidepressants, including like amitriptyline, nortriptyline, a lot of the MAOIs, any antihistamines that treat asthma, hay fever, and urticaria, anything that can enhance the anticholinergic effect. Some clinical uses for this is COPD, overactive bladder or incontinence, gastrointestinal disorders such as diarrhea, symptoms of like Parkinson's disease, asthma, dizziness, motion sickness. It's actually given before or during surgery to regulate the heartbeat and lower salivation. And then an off-label use could be for excessive sweating. So some different monitoring is obviously you want to monitor for these effects, these anticholinergic effects, and make sure they don't get to a toxic level, which can be seizures, coma, and cardiotoxicity, which can lead to death. So administration reasons, these come pretty self-explanatory in tablets, liquids, syrups. They come in gels, they come in patches, pretty much anything, and it comes on the bottle. So the administration education is not very hard to explain. So the first main takeaway are these side effects make you can't pee, can't see, can't spit, and can't poop. So the second takeaway is to be cautious when prescribing to older adults. They're already slowing down in general, so you want to be careful not to slow them down to a point where it'll be toxic to them. And then the third takeaway is to make sure you educate your patients to avoid being in the hot sun or anywhere where they're going to be excessively hot because of their increased risk of having a heat stroke with these drugs. Thank you.